Tonight on CU at USC, we have Dr. Ginny Yip. She's a clinical psychologist here in Los Angeles and an expert in anxiety disorders and OCD. I'll also ask her about her new book on procrastination, an important subject for us all right around midterms. That's all coming up here on Trojan Vision. Good evening, everyone. I'm Cole Sullivan. Thank you so much for being here, and thank you also, Dr. Yip, for joining us tonight.
Thanks for having me, Cole.
So I wanted to get started by asking you how you got your start. How'd you get into psychology?
Well, don't you think the human mind is just fascinating?
Mm-hmm.
Well, I took a course in high school in psychology, and I just fell in love with it, and that was it.
And so you specialize in OCD and anxiety. What made you want to specialize in those specific fields?
You know, I didn't know that's what I wanted to do initially. I initially wanted to go into forensic psychology. However, I come from a family where we all have OCD. Mm-hmm. And once I was able to put a label to it, it was just so relieving. And I did an internship with an expert in Washington, D.C., and from that point on, that was it. I just knew this was what I wanted to do.
So you talk about how comforting it was to put a label on OCD. What exactly is OCD for all of us? Because we hear it all the time around college. We hear, oh, I'm so OCD, or oh, you're so OCD.
Yes.
What exactly is it? What's the definition of OCD?
Okay, well, there are two parts to OCD. There are obsessions, and then there are compulsions. Obsessions are thoughts, images, or sensations that repeatedly come into your mind, and they're uncontrollable. Many times the thoughts are frightening and they make you feel like something bad will happen, and naturally so, it raises a lot of anxiety and fear. Kind of like having a nightmare that keeps replaying in your mind over and over again. Now, on the other hand,
what would be an example of an obsession then? What would kind of be something that you hear often?
Well, an obsession is not just like, oh, I'm obsessing over my date tonight,
mm-hmm.
or I'm obsessing over the new song. Obsession has to interfere with your life. So, for example, let's say that you fear being contaminated and having HIV, okay? That thought will not escape your mind. You're going to constantly be vigilant over anything in the environment that might potentially be contaminated, such as, ooh, there's a red spot there. That might be blood. Mm-hmm. And the thought is repetitive. So it keeps coming back, and you just can't get rid of the thought. That's an obsession.
Mm-hmm. So what's a compulsion then? What's the definition, and what are some examples of it then?
Sure. Well, compulsions, on the other hand, these are our physical or mental reactions, things that we do to make ourselves feel better or to keep the bad things from happening. They can take up a lot of time, and they can feel like rules that you must follow.
Mm-hmm. So together those two combine to become OCD.
Absolutely. The thing is, one compulsion is never enough before the next obsession returns. And when that happens, you have to perform the compulsion again. Over time, these bonds get stronger, harder to break, and eventually you end up with a vicious cycle of obsessions and corresponding compulsions.
So the obsession then leads to the compulsion in an attempt to reduce the obsession.
Unfortunately, yes.
So is OCD genetic? Is it something that runs in your family, or is it not always genetic? How do you see that playing out?
Well, so far we don't know exactly what causes OCD. We know that there are a number of contributors. Genetics is one of them. Mm-hmm. We know that the neurotransmitter serotonin, which is one of many brain chemicals that transmit messages, is also a contributor. We know that there can even be viral infections where your body's antibody starts attacking various parts of your brain that can trigger OCD, as well as environmental stressors can trigger OCD as well.
So when you talk about environmental stress, is that something that in our modern culture is heightened? Is that something that leads to more OCD incidents?
You know, I can't say that to be so because we've always had OCD. OCD is not a modern disease. It's not a new phenomenon. Even Macbeth kept washing her hands, right? And that's OCD. So I can't say that it is a new phenomenon.
So when do symptoms usually develop? Is it something that you have from a very early age, or is it something that develops over time, or does it depend?
Well, we know that from statistic, there are 2 points in time where OCD are more common to develop. One is between the ages of 8 and 12, and then the other point in time is during early adulthood. However, at the Renewed Freedom Center in Los Angeles, we see kids as young as 3 years old with full-blown OCD.
And I want to talk about the Renewed Freedom Center in just a moment, but first I want to ask you, are there typical symptoms for OCD? How do you recognize if you or someone else has OCD?
Okay, well, first of all, you have to have obsessions, okay? So these are the intrusive fears, intrusive thoughts, and to help you feel better, because naturally, if you're confronted with a fear, you're going to experience anxiety and discomfort, right? So we all live in a society where we don't like to experience discomfort, and therefore we engage in compulsions in order to undo the fears, right? And then we get relief. It feels better. The problem is that's never enough. It's going to come back, and it's going to come back. And it comes back so often and becomes such a repetitive pattern that it can take up many hours of your day, interfere with your functioning, where you can't get out of your house, you can't get anything done, you get behind on schoolwork, and it takes up your whole life. That is when it becomes OCD.
So it's like the difference between me feeling a little nervous about the broadcast tonight and having a routine for the mic check, and then kind of having that continue to such an extreme level that I can no longer function.
Yes, yes. So think of superstitions, right? Superstitions are preferences. Let's say they're preferences. You know, I don't like to walk under ladders. I don't want to live on the 13th floor, right? However, what if there's nowhere else that you can live except the 13th floor? What are you going to choose? If you don't have OCD, all right, I'll live on the 13th floor, no big deal. However, if you do have OCD, okay, no way in hell am I going to end up on the 13th floor, because something bad will happen. And therefore, I'd rather live on the street. I'd rather live in my car. I'd rather live in a box than live on the 13th floor.
So it's that extreme reaction to the fear.
It is. And, you know, if you think about it, we all have OCD tendencies. And that's not a bad thing, right? Because you need to have a little bit of meticulousness in order to get through school, right? The problem is when you take that too far, and when you let that run your life, and when you can't live your own life and you have to follow these rules that are excessive and ridiculous, that's when it becomes a disorder.
So you talked about how it was such a relief for you to realize that OCD was the label.
Yes.
So then you went and founded this Renewed Freedom Center. Talk a little bit about what made you want to start that and what you do there.
Well, there are many kids today, adults as well, with OCD who are undiagnosed or misdiagnosed. And unfortunately, that's because there's a lack of awareness. So unfortunately, many mental health professionals aren't able to diagnose because they're not really familiar with the diagnosis of OCD. So I started the Renewed Freedom Center for Rapid Anxiety Relief in Los Angeles back in 2008. So that we can have a treatment center tailored specifically for this population. And
I think it's interesting that you named it the Renewed Freedom Center. It's like you're giving a new sense of freedom to the people you treat with OCD.
It is.
So how do you go about treating people with OCD?
Well, the evidence-based treatment is cognitive behavior therapy, which is CBT. It's not your traditional talk therapy or play therapy. In CBT, you learn tools to defeat the OCD monster. One specific tool that you'll learn is called exposure and response prevention, which trains you to confront your fears gradually so that you learn they're not really that threatening.
So say if you're afraid of heights and that's kind of a fear that you have, how do you go about using this kind of therapy?
We'll
to get
take
away
you
from
skydiving.
that? Okay. So you literally immerse the person in what they're
Gradually.
Yeah.
Gradually, yes. When they're ready. Of course, we have to educate them about what OCD is, right?
Yeah.
Because nobody wants to face their fears. So I have to teach you everything that you have to learn about OCD and anxiety, because at the end of the day, the goal isn't for you to depend on me for treatment. The goal is for me to teach you these tools, for
That you can
you,
then-
yes, and then for you to learn and apply these tools.
So talk about how cognitive behavior therapy is different from what you said, talk therapy or some sort of medication. What are the differences between those?
Well, cognitive behavior therapy basically is that we teach you how to identify negative thought patterns so that they reflect reality more accurately. And we teach you how to behave in ways so that it's more adaptive to your environment. Unlike talk therapy or psychoanalysis, the goal is to gain insight into your life, into your childhood. In cognitive behavior therapy, insight really isn't important. What's important is that you learn tools to manage your symptoms right now.
Yeah, so rather than talking about what maybe the basis of the fear is, it's saying, look, you don't need to have the fear anymore.
That's right. You don't need to have the fear anymore because you're facing your fears.
So is there medication available for those with OCD?
There is. However, as a clinical psychologist, I really don't treat with medications. At my treatment center, we use CBT.
Yeah. And you also have something that's really cool at the Renewed Freedom Center is that you treat the whole family. You have family therapy for those with OCD as well?
We do. It's so important to work with the entire family. If you can imagine that OCD is never contained with just a sufferer, right? So if you're afraid of something, you're going to ask your family members to help you with your compulsions. You might ask them a million times whether this is safe or is not safe. And what ends up happening is that it becomes a vicious cycle within the family. A lot of family members get frustrated with the sufferer. And if family members don't comply, then the sufferer would become angry and have emotional meltdowns. Unfortunately, at this point, many family members give in to the OCD because they want to maintain peace, and also they don't really know what else to do.
So by teaching the whole family how to kind of deal with that, what are some of the things you would say to the family? Is it that you go with the OCD, or you say, look, this isn't something you need to be scared of?
Well, you know, I can go on a completely different spiel on that and take them another 30 minutes. However, to give you the short and simple answer is we teach family members how to be supportive without enabling the condition, how to be supportive of their family member without supporting OCD. In essence, it's a team approach. So we're all on a team to defeat the OCD monster.
Great. Well, that sounds like a great thing. And when we come back, I want to ask you about your new book. Because right around midterms, I had a midterm this morning, and I want to make sure that I'm doing everything right. That procrastination isn't going to get me.
I remember those days.
Yes. So we're going to have that much more with Dr. Ginny Yip when we return. Stick with us. Awesome.
Smile, baby Jane. You've been acting so strange lately.
Nothing's of it, Lee.
Got a bad case of senioritis? Too many kickbacks on the row? What's eating you, doll? Who is he? Who's stolen your heart?
You couldn't handle it.
I bet he's ugly as sin.
He's got me full-blooded and heart a-swaying again. He's smart, imaginative, dapper and charming, and not to mention more handsome than good luck. Oh, and twice as sweet.
Who?
Sup. Trojan Vision. Pleasure.
Who's this clown?
The current Casanova.
Hey, Shug, what are we watching tonight?
Welcome back, everyone. We're with Dr. Ginny Yip, but before we get to talking about procrastination and her brand new book, I want to tell you how you can stay in touch with us here at CU at USC. If you want to follow us on Twitter, it's at CU USC. I'm at Cole_SULL. And if you want to find out more about Dr. Ginny Yip, you can go to her website, dryip.com. Now, Dr. Yip, I want to ask you, you wrote this great book about procrastination. What made you want to write it?
Well, you know, I've had a lot of students and patients who've suffered from procrastination, and unfortunately, there's one huge contributor is anxiety.
So how does anxiety contribute to procrastination?
Well, you know, anxiety is not necessarily a bad thing. We all need anxiety to motivate us to do something. And if none of us experienced anxiety, we wouldn't be motivated to do anything. So anxiety is really important to understand in this process. So that's what this book is about.
And one of the things that really stood out to me about this book is you use different examples, and you use an example of Ted, who's a college student, which is so relevant to me and to us here in our audience. And so Ted's problem is he was a really good student in high school, and then when he came to college it got more difficult.
Yes.
And as a result of the difficulty, he started to develop anxiety, which then led to procrastination. Is that something you see often?
We do. You know, I call Ted the perplexed procrastinator.
Yes.
And this is what happens when we see vague tasks and we have no plan of attack. So one of the things that I teach my patients as a clinical psychologist is to break mountains into molehills.
Yeah.
And by doing that, you're learning to have a blueprint for anything that you need to do, and to basically have a set time and schedule for when to do all of that.
So for Ted, you recommend setting out an agenda, right?
Absolutely. Everyone needs an agenda, otherwise we get lost.
So kind of working, you also talk about working back from the due date of the project or paper or whatever it is, and really planning out, scheduling exactly when you're going to do each task.
Yes.
And that's a way to kind of, I guess, break mountains into molehills. That's what you talk about.
That is one of the ways. It's kind of like developing an outline, something that we've all learned to do. When we have a vague task, we become overwhelmed, right? Because we can't see the beginning from the end. And we need to have a plan of attack to break down this vague task, and that's why we do outlines. It's much easier to work backwards, though, as you said, because that way we know when our deadline is, what we need to get done by that point, and how much time we have to do X, Y, and Z.
Exactly. So you talk about breaking the kind of cycle of procrastination then. So is the way that Ted, the perplexed college student, breaks the cycle of procrastination is by setting this kind of agenda?
That's one of the ways. So there are many, there are 4 basic components that I always teach my students and patients. First of all, it is breaking mountains into molehills, because otherwise you just get lost along the way, and we don't want that. And then following that, you have to schedule it. You have to schedule exactly what you're going to do when, because with over 1,400 minutes in a day and over 160 hours in a week, we just have too much time to procrastinate. So that is the second thing that we do. And then we have to basically identify the mental thought traps. The mental thought traps are they're like negative self-talk that wreaks havoc to your mental health and emotional health. And then we have to visualize, which you basically have to visualize actually doing the work.
Yeah. So one of the things that I really found interesting in your book was talking about how the flight or fight response really works into the procrastination. How do you see that happening?
Yes. Well, you know, anxiety is your subjective experience. Okay, what's actually happening objectively is your body's fight or flight response at work. So, for example, when you perceive a threat, your body's alarm system gets activated. And when that happens, it sends a flood of energy throughout your body so that you can either fight or run from the perceived danger, right? The problem is that the fight or flight response cannot tell the difference whether it's a real danger or a false alarm. It simply reacts to whatever threat you perceive. Now, imagine if you have your exam tomorrow morning.
Okay.
And you haven't studied yet.
Yeah.
Do you think you'll do well tomorrow?
If I haven't studied yet, probably not.
Probably not. Now, what will get you to study?
I guess the knowing that I have to do well in the exam tomorrow. I have to study for tomorrow.
And it's a threat, right? Because
Yeah,
there's,
if I don't do well,
if you don't do well,
the
then
repercussions, my parents will not be very happy with me.
Right, and that's not good.
No, that's not good at all.
That's not. So one of the important things that people don't understand is we need that potential threat, whether it's the classic saber-toothed tiger or that exam hanging around the corner. And we need to feel that adrenaline rush to get us motivated, energized, driven to do what's necessary to overcome that threat.
So how does that work into procrastination then? Because if I've procrastinated studying for that exam for a whole week now, knowing it's going to be tomorrow, and then I know that if I get to this point where I have to study, I will study, is that a good thing? I think not.
Probably not.
No.
However, it works.
Yeah.
A lot of people ask me, well, Dr. Yip, why can't I just wait till the last minute? It works. And the answer to that is that it's true because the threat is more imminent.
Yeah.
And therefore, your fight or flight response is at an all-time high. However, let's say that you have to write a paper,
Okay.
which takes critical thinking skills. Do you think you'll be able to write a paper cramming last minute?
It probably won't be as good a paper if I do that.
Probably
And it
not.
won't be as enjoyable, or it won't be enjoyable at all to write the paper.
Exactly. So this is where scheduling is so important. We have to schedule the task backwards so that you see when you have to get what done.
Yeah. And so that's kind of, I guess, the argument against being a, quote, good procrastinator, is that in the end it doesn't work out.
Well, I can't say that at the end it doesn't work out. It may work out. It might not work out to your expectations.
So I want to ask you also, is procrastination a form of OCD then? Do you see it as a form of OCD?
Procrastination can be a result of perfectionism. Perfectionism is a type of OCD. So if you have perfectionistic tendencies, so in my book I have the character Raquel, she has perfectionistic tendencies. And whenever she feels like she will fail, then it actually becomes too anxiety provoking for her to keep moving forward. And rather than her body's fight or flight response motivating her toward her goal, it actually debilitates her.
So how do you go about breaking that? How do you go about advising someone against that kind of procrastination?
For perfectionism, well, first of all, you have to understand that perfectionism isn't real, right? What one person perceives as perfect isn't going to be the same as what the other person perceives. Some people say practice makes better. I believe practice makes habit. If you practice a skill enough, then it becomes a habit. And that is much more realistic than being perfect.
So that's the way you kind of say, look, you got to practice it to get it to become a habit, rather than it's not going to be practice makes perfect, because you're never going to be perfect.
Right.
It's just something you have to do to get better at it.
But, well, it's something that you have to do to make it a habit. I can't say that you can get better. You know,
Exactly.
I can say that, well, I'm going to practice flying. I can practice all I want.
You can jump off as many walls as you want, but you probably won't be able to fly.
No, I won't. However, the motion that I go through, I'm going to get really good at the motion.
Yeah, exactly.
It'll become habit.
So I want to ask you also, something we hear a lot in college is people who work all the time, workaholics. Do they procrastinate at all?
You know, it's not that they procrastinate, it's that they overextend themselves. So they try to fit so many things into their day that they're not getting everything done. So something that they might have missed gets on the back burner. And if it doesn't get rescheduled, then it stays on the back burner. And the important thing is not to have a list of things that you need to do. Having schedules, and schedules that are realistic, that you can fit everything into that you need to do rather than overextending it, is the most important part.
So do you see that kind of workaholic as also a kind of anxiety disorder, that you want to work all the time so you don't do poorly?
It really depends. This is a very similar question as when I have parents asking me, well, what's wrong with perfectionism? And in my book, I tell you that if it is taking up all of your time, all of your life, from pleasurable activities, from social activities, then it probably is more anxiety driven.
And I want to ask you, we only have about a minute and a half left. This is a question I like to ask lots of different guests just to get their different takes. What advice would you give to someone in about 30 seconds? Just advice to a college student who may be watching right now.
Well, face your fears so that you can confront them and get rid of them, and also read my book.
Absolutely. It's called Productive Successful You. It's by Dr. Jenny Yip. She's a clinical psychologist and also an associate professor of psychiatry here at the USC School, Keck School of Medicine.
Clinical assistant.
Clinical assistant. Thank you so much for joining us, Dr. Yip. It's been a real pleasure to have you on. Thank you so much for watching. Haley will be back next Tuesday. I'll be here next Monday. Until then, good night.
You're watching Trojan Vision. For more of your favorite shows, check us out at trojanvision.com and like us on Facebook.